The storm arrived without warning, swallowing the coastline in darkness as military helicopters circled above Fort Liberty Naval Medical Center. Ambulances raced through the gates one after another, their sirens drowned beneath the roar of thunder. Inside the emergency wing, doctors prepared for the arrival of the nation's highest-ranking wounded officer, Admiral Nathan Cross, a decorated war hero whose leadership had saved countless lives. The entire hospital was placed on lockdown. "Everyone stay focused," the chief surgeon ordered. "The Admiral has survived the impossible before. He deserves our best." Among the busy nurses stood Lieutenant Emma Carter, the newest member of the trauma unit. She had transferred only 3 weeks earlier and was still treated like an outsider. Some senior staff believed she had earned her position through luck rather than skill. "She's too young," one nurse whispered. "She'll panic under pressure," another replied. Emma heard every word but stayed silent. Years of military service had taught her that respect was never demanded. It was earned. The ambulance doors burst open. Admiral Cross was rushed inside, pale from blood loss, his breathing uneven. His combat uniform was torn and deep wounds covered his chest and shoulder. Monitors screamed as doctors surrounded him. "Admiral," the chief surgeon said, "you're safe now." The Admiral slowly opened his eyes. His gaze drifted across the crowded room until it stopped on Emma. His expression suddenly changed. He raised a trembling hand and pointed directly at her. "I only accept operator Payacentuam." The room fell completely silent. Every doctor looked at Emma. Every nurse stared in confusion. The chief surgeon frowned. There must be some mistake. The Admiral struggled to breathe. "No mistake." He pointed again. "Her." Emma's heartbeat quickened. One of the surgeons laughed nervously. "She's just a trauma nurse." The Admiral's voice became stronger despite his pain. "She isn't just a nurse." Nobody understood. The chief surgeon turned toward Emma. "Do you know the Admiral?" Emma hesitated. "No, sir." The Admiral shook his head. "Yes, she does." Emma looked into his eyes, searching for an answer hidden somewhere in the past. Nothing came. "I've never met him." The Admiral whispered one word: "Phantom." The name struck Emma like lightning. A memory she had buried years earlier flashed through her mind. A classified training facility, a black uniform with no name tag, a voice saying, "From today forward, your identity does not exist." Emma closed her eyes. She had promised never to speak about those years again. The chief surgeon noticed her reaction. "What is Phantom?" Emma slowly opened her eyes. "It's nothing." The Admiral forced a weak smile. That's exactly what she was trained to say. Suddenly the cardiac monitor dropped sharply.
"His pressure is crashing!"
a doctor shouted. The trauma team rushed into action. The chief surgeon prepared to intubate. Emma stared at the Admiral's breathing. Something felt wrong. Very wrong. She stepped forward. "Wait." The surgeon ignored her. Emma spoke louder. "Stop." The room froze for a split second. She pointed toward the Admiral's neck. "You're treating the visible wounds." The surgeon frowned. "What are you talking about?" Emma's voice remained calm. "The real injury isn't in his chest." The monitor let out another piercing alarm. The Admiral looked directly at Emma. Then, with the last of his strength, he whispered words that sent chills through everyone in the room. "I knew you'd remember. Phantom." The room fell into stunned silence. Every eye turned toward Emma. The chief surgeon tightened his jaw. "We're losing him," he snapped. "Step aside." Emma didn't move. She kept watching the Admiral's neck. "His airway isn't failing because of blood loss." The surgeon frowned. "Then why?" "Look below his collarbone." A resident pulled back the torn uniform. A faint swelling spread beneath the skin. The surgeon's expression changed. "A hematoma," the Emma nodded. "It's expanding. Another minute, and it will crush his airway." "How did you see that?" "I've seen it before." The surgeon reached for the intubation equipment. Emma stopped him. "Not yet." His patience disappeared. "You're a trauma nurse, Lieutenant. I'm the surgeon. And if you force that tube now, you'll rupture the swelling." The monitor shrieked again. The Admiral struggled for air. The room filled with panic. "Doctor!" a resident shouted. "Oxygen is dropping." The surgeon hesitated. just long enough to realize Emma had remained completely calm. "What do you recommend?" "Emergency neck decompression. Right now." The surgeon stared at her. "That procedure isn't routine." "No," Emma answered quietly. "Neither is this patient." He took a breath. "Do it." Emma guided his hands. Lower. 2 centimeters. The incision was made. Dark blood escaped under pressure. The swelling immediately softened. The Admiral drew a deep breath. His oxygen climbed. Relief swept across the room. One of the nurses whispered. She was right. The surgeon slowly looked at Emma. "Where did you learn that?" Emma looked away. "Long ago." Before anyone could ask another question, an orderly rushed inside. "Sir, security just found this in the Admiral's transport helicopter." He handed over a sealed military pouch. The Admiral weakly lifted a hand. "Give to Phantom." The surgeon looked confused. "It belongs to the hospital now." The Admiral's voice hardened despite his condition. "It belongs to her." Emma accepted the pouch. Its seal carried an insignia she hadn't seen in 12 years. A black falcon. Her pulse quickened. She carefully opened it. Inside was an old photograph. 5 operators stood together in unmarked uniforms. Every face was covered except one, hers. Across the back, someone had written a single sentence. "If Phantom ever returns, trust only her." Emma's hands trembled. The surgeon noticed. "What is this?" She swallowed. "A mission that officially never happened." Before he could ask another question, alarms exploded once more. The Admiral's heart rhythm became dangerously irregular.
Ventricular tachycardia!
The crash cart rolled in. The surgeon prepared the defibrillator. Emma watched the monitor for only a second. "Wait." He looked at her in disbelief. "You've already stopped me twice, and both times he survived." The room became silent again. Emma stepped closer to the Admiral. She looked beneath his left shoulder. Then she froze. "None." "What?" She pointed toward a tiny puncture wound almost hidden beneath dried blood. "This wasn't caused by shrapnel." The surgeon examined it. "It looks like a needle mark." Emma's face turned pale. "It is poison." She slowly shook her head. "Worse." The surgeon stared at her. "What could possibly be worse than poison?" Emma's voice dropped to almost a whisper. "Someone tried to make this look like a combat injury." The realization swept across the room. This wasn't just an accident. Someone wanted Admiral Nathan Cross dead. And somehow, they already knew Phantom would be waiting for him. The room turned silent as Emma's words settled over everyone. The chief surgeon stared at the tiny puncture wound beneath the Admiral's shoulder. "You're saying someone attacked him before he reached this hospital?" Emma nodded. "This wasn't caused by the explosion. It was done deliberately." The Admiral struggled to lift his hand. "Phantom, finish the mission." His heartbeat suddenly slowed. "Pulse is dropping," a resident shouted. The surgeon prepared another dose of medication. Emma stopped him. "No, that drug will make it worse." He looked at her with frustration. "Then tell me what's happening." Emma examined the Admiral's eyes, breathing and skin. The injection wasn't poison. It was a powerful paralytic designed to imitate traumatic shock. Whoever used it wanted doctors to treat the wrong problem until it was too late. The surgeon immediately changed course. "Reverse the paralysis. Move." The trauma team worked together without hesitation. Within seconds, the Admiral's breathing became stronger. His heart rhythm stabilized. A wave of relief spread through the room. The surgeon slowly turned toward Emma. "I misjudged you." Emma shook her head. "This isn't about me." The Admiral opened his eyes. A faint smile crossed his face. "I knew only Phantom would see the truth." Mara, no, Emma, finally understood why he had recognized her. Years earlier, during a classified multinational rescue mission, she had secretly saved Admiral Cross after his convoy had been ambushed. Her identity had remained hidden under the call sign Phantom, and the mission had been erased from every official record. The Admiral had never forgotten. Hours later, after emergency surgery, he regained full consciousness. The hospital staff gathered outside his room. The chief surgeon stepped forward. "Sir, everyone wants to know one thing." The Admiral smiled. "Who is Phantom?" He looked directly at Emma. She is the operator who volunteered for the missions no one else would accept. The hallway fell completely silent. She rescued civilians under enemy fire without asking for recognition. She carried wounded soldiers across mountains. She saved my life once before tonight. Emma lowered her eyes. I was only doing my duty. The Admiral shook his head. Heroes always say that. News of the night's events spread across the hospital. The same staff who had dismissed Emma only hours earlier now greeted her with respect. The nurses who once whispered about her apologized. The chief surgeon extended his hand. You earned every bit of that uniform. Emma accepted the handshake. Thank you, sir. A week later, Admiral Cross prepared to leave the hospital. Before departing, you stopped beside Emma. You've spent years hiding behind a forgotten call sign. Emma smiled softly. It was never about the name. No, the Admiral replied. It was always about the person behind it. He removed a challenge coin from his pocket. On one side was the Navy emblem. On the other was a single word. Pitom. I've carried this since the day you saved my life. He placed it in her hand. I think it belongs with its rightful owner. Emma closed her fingers around the coin as tears filled her eyes. For years she had believed her greatest sacrifices would remain invisible forever. She had been wrong. Sometimes the world remembers its heroes exactly when they are needed most. As Admiral Cross walked toward the waiting vehicle, he turned one final time and saluted. Emma returned the salute with quiet pride. She no longer needed to hide from her past. She had embraced it. The hospital would never remember her as the new nurse everyone underestimated. They would remember the calm professional who saw what no one else could see. The woman whose courage saved an admiral's life when every second mattered. They would remember Operator Phantom. And perhaps the greatest heroes are not the ones whose names appear in history books, but the ones whose courage changes lives without asking for applause. If this story inspired you, subscribe for more emotional military and medical dramas celebrating courage, sacrifice, and the extraordinary heroes hidden among ordinary people.